The vertebral column is composed of 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, fused to form the sacrum, and 4 coccygeal, which are also fused. Because it is segmented and made up of vertebrae, joints, and pads of fibrocartilage called intervertebral discs, it is a flexible structure. The following movements are possible: flexion, extension, lateral flexion, rotation, and circumduction. Flexion is an anterior movement, and extension is a posterior movement. Both are extensive in the cervical and lumbar regions, but restricted in the thoracic region. Lateral flexion is the bending of the body to one or other side. It is extensive in the cervical and lumbar regions, but restricted in the thoracic region. Rotation is a twisting of the vertebral column. This is least extensive in the lumbar region. Circumduction is a combination of all these movements. Although vertebrae show regional differences, they all possess a common pattern. A typical vertebra consists of a rounded body anteriorly and a vertebral arch posteriorly. This encloses space called the vertebral foramen, through which run the spinal cord and its coverings. The vertebral arch consists of a pair of cylindrical pedicles which form the sides of the arch, and a pair of flattened lamina which complete the arch posteriorly. The vertebral arch gives rise to 7 processes, 1 spinous, 2 transverse, and 4 articular. The spinous process, or spine, is directed posteriorly from the junction of the 2 lamina. The transverse processes are directed laterally from the junction of the lamina and the pedicles. Both the spinous and transverse processes serve as levels and receive attachment of muscles and ligaments. The articular processes are vertically arranged and consist of 2 superior and 2 inferior processes. They arise from the junction of the lamina and the pedicles. The 2 superior articular processes of one vertebral arch articulate with the 2 inferior articular processes of the arch above, forming 2 synovial joints. The pedicles are notched on their superior and inferior borders, forming the superior and inferior vertebral notches. On each side, the superior notch of one vertebra and the inferior notch of an adjacent vertebra together form an intervertebral foramen. These foramina in an articulated skeleton serve to transmit the spinal nerves and blood vessels. A typical cervical vertebra has the following characteristics. First of all, the transverse process possesses a foramen transversarium for the passage of the vertebral artery and veins. Note that the vertebral artery passes through the transverse processes C1 to C6 and not through C7. Next, the spines are small and bifid. The body is small and broad from side to side. Now look to the vertebral foramen. It is large and triangular in shape. The superior articular processes have facets that face posteriorly and superiorly, and the inferior processes have facets that face inferiorly and anteriorly. The first, second, and 7th cervical vertebrae are atypical. The first cervical vertebra, or atlas, does not possess a body or spinous process. It has an anterior and posterior arch. It has a lateral mass on each side with articular surfaces on its upper surface for articulation with the occipital condyles in the atlantar occipital joints. The articular surfaces on its inferior surface articulate with their axis in the atlantar axial joints. The second cervical vertebra, or axis, has a peg-like odontoid process, dens, that projects from the superior surface of the body. Actually, it represents the body of the atlas that has fused within the body of the axis during the development. The 7th cervical vertebra, or vertebra prominens, is so named because it has the longest spinous process, and the process is not bifid. The transverse process is large, but the foramen transversarium is small and transmits the vertebral vein only. A typical thoracic vertebra has following features. The body is medium size and heart-shaped. The vertebral foramen is small and circular. The spines are long and inclined downward. Costal facets are present on the sides of the bodies for articulation with the heads of the ribs. Also, costal facets are present on the transverse processes for articulation with the tubercles of the ribs. Paying attention, T11 and T12 have no facets on the transverse processes. The superior articular processes bear facets that face posteriorly and laterally, whereas the facets on the inferior articular processes face anteriorly and medially. The inferior articular processes of the T12 vertebra face laterally to fit bolts in their lumbar vertebra, like this. A typical lumbar vertebra has the following features. The body is large and kidney-shaped. The pedicles are strong and directed backward. The lamina are short in a vertical dimension. It is important when performing a spinal tap. The vertebral foramina are triangular. The transverse processes are long and slender. The spinous processes are short, flat, and quadrangular, and project posteriorly. The articular surfaces of the superior articular processes face medially, and those of the inferior articular processes face laterally. Note that the lumbar vertebra have no facets for articulation with ribs and no foramina in the transverse processes. The sacrum consists of 5 rudimentary vertebrae fused together to form a wedge-shaped bone which is concave anteriorly. The upper border or base of the bone articulates with the thick lumbar vertebra. The narrow inferior border articulates with the coccyx. Laterally, the sacrum articulates with the 2 iliac bones to form the sacroiliac joints. The anterior and upper margin of the first sacral vertebra bulges forward as the posterior margin of the pelvic inlet and is known as the sacral promontory. The sacral promontory in the female is of considerable importance and is used when measuring the size of the pelvis. The vertebral foramina are present and form the sacral canal. The lamina of the 5th sacral vertebra and sometimes those of the 4th also fail to meet in the midline, forming the sacral hiatus. Here it is. The sacral canal contains the anterior and posterior roots of the sacral and coccygeal spinal nerves, the filum terminale and fibra fatty material. The anterior and posterior surfaces of the sacrum each have 4 foramina on each side for the passage of the anterior and posterior rami of the upper 4 sacral nerves. The coccyx consists of 4 vertebrae fused together to form a single small triangular bone that articulates at its base with the lower end of the sacrum. The first coccygeal vertebra is usually not fused or is incompletely fused with the second vertebra, so it can reflex backward.